Welcome to another episode of Insights from the Trenches, a series dedicated to helping ADHD couples thrive by empowering couples with insights from ADHD experts and ADHD peers. I'm Alice, your host. In today's episode, we discuss the topic of navigating medical insurance in the U.S. with licensed mental health counselor Ashley Paradise. She has over 20 years of experience and a unique background working both as a therapist and within the insurance system. So grab a cup of coffee and let's thrive together. Welcome, Ashley.
Thank
Very
you.
good to see you here. Can you tell me a little bit about your background as a therapist and your experience working with ADHD and alongside with medical insurance system?
Sure, absolutely. So my background educationally is I'm a licensed mental health counselor, which means I'm a master's level clinician that had to do several years of practicum work post-grad in order to obtain a license. I've been doing this work for about 20 years now. The first half of my career was more in direct care. I spent a lot of time working inpatient mental health with the chronic and acute mentally ill. And then the last 10 years of my career in managed care, working and overseeing primarily New York State, but I also had a few states along the way over the past 10 years, managing utilization and case management.
Wow. So you do work with insurance or dealing with it for quite some time then.
Right. Yeah. So on both sides, I'm a consumer of insurance, right? I take insurance, and I also work on the insurance side up until very recently.
Mm-hmm. And how did you got in touch with working with the ADHD community?
So the ADHD community really came around because of events happening and unfolding in my own life that I realized even as a trained therapist, I was not equipped for. So I sought my own professional support and really learned that what I had learned in my education was not enough to work with adults with ADHD, let alone relational matters and marriages and what have you.
What got you interested in working with ADHD clients or couples with ADHD?
Yeah, it's really from my own experience in my own marriage. I'm a non-ADHD partner. My husband has ADHD, and really learning the different, not being aware of the different patterns and dynamics that emerge from these type of couplings was really detrimental in the early stages of our relationship. So going through the process myself as a consumer was incredibly helpful and inspired me then to learn the material and help others.
That's great. Thanks for sharing your personal experience. And now, with you having experience on both sides of the fence on the medical insurance, someone with ADHD or a couples where is affected by ADHD, why is navigating medical insurance even more challenging?
Yeah. So absolutely. And just to reiterate it, navigating insurance for anybody, ADHD, non-ADHD, is can be very difficult. And then the other piece is that every insurance company is different and what they offer is different. And depending on where the state in which you live, state benefits and insurance can also be different. So it's all encompassing, right? There's a lot of variables that shift from state to state, from situation to situation, even from plan to plan. So what I find most difficult is really the level of executive functioning that can sometimes be needed to get the answers you need about insurance and finding the right support, right? There can be confusing sort of like rules around network and in-network coverage, just understanding co-insurance, premiums, benefit limits, step therapy requirements in terms of the actual operational pieces of insurance. And then on top of that, finding a provider that could meet the needs of you as a couple or you as an individual with the ADHD can also be difficult. Understanding types of treatment, what type of assessment and testing is out there for you, and what is considered evidence-based and billable versus not. So there's a lot of, in my opinion, a lot of requirements around, or not requirements, but expectations around executive functioning to sort of learn this information, retain it, organize it, ask questions, be assertive in advocating for your needs when you don't understand an answer, et cetera.
Yeah, I think a lot of
challenges, especially from the non-ADHD partner side, not really understand how ADHD impacting the executive function.
Hmm.
Um, really couldn't comprehend, if you don't understand that, you can't really comprehend how making a phone call could be frustrating because the partner has to wait on the call,
Hmm.
getting an answer or trying to navigate the systems,
Right.
as an example.
Right. Yeah. I
So,
mean, that's a big piece that I neglected to mention, which I think you're touching upon, is even before you get someone on the line, taking the time to organize when you're going to call. A lot of these insurance companies now have long wait times, or they have supplemented AI chatbots, sometimes live chat, in order to sort of scale back on the live calls. So by the time you really get someone, and that could be a quite a while, and can be quite a goal to overcome or bear it
got
over.
it. What are the most common mistakes you see ADHD couples or individuals make when seeking help?
What I see the most is, one, couples not really vetting their providers, to make sure that their providers are educated in adult ADHD and at least have some understanding of how ADHD shows up relationally. Most therapists, unless you have a doctoral background, are trained at a master's level. And while we learn about ADHD, we learn about the diagnostic criteria for ADHD, we're really not getting a lot of that education, how ADHD presents in adults. And a lot of therapists, including myself, will work in settings like, I don't know, schools or child psych. And we'll say, of course, we know what ADHD is. It's a specialty I offer because we have this experience. And the reality is that how ADHD presents in adults and in marriages it is very, very different than children. So the first thing I see couples get into is not really knowing what questions to ask their providers around their background, their training, and how they're educated and how they're oriented and what their approach is around adult ADHD. The next sort of thing I see sequentially that can be a misstep is that they don't really know what questions to ask around out of network and in network. There's a lot of variables here as well, right? So if someone is out of network, we want to know what they're charging per session. You want to know what if your insurance covers out of network reimbursements. Sometimes insurances do not cover out of network at all. So you're at a bit of a loss. So they're seeing these providers, they're not realizing that they're not in network, and they're getting these bills that the insurance company is failing to pay. And then the last thing I'll say is that some couples aren't able to, they have trouble discerning, like, if they both have health insurance, which plan is better for what they need. Some depending on the insurance the individual carries, may have certain session limits or step therapy requirements around medications that could be very limiting, while in others may not. So as you can see, there's a lot of moving parts around narrowing down how to get situated with a provider, a competent, educated provider that accepts insurance.
Got it, got it. So, what do you think is the most effective way for ADHD couples or individuals to find qualified therapists who are actually covered by their insurance?
Ideally, what couples should do, or what couples could do, is call their insurance company and say, hey, we need a provider that specializes in adult ADHD. Can you help us identify who locally is in network? And the insurance company, most insurance companies do this, by the way, they have customer service, or they have a case management team that will actually spend a business or 2 business days collecting those referrals. And sometimes the insurance company will vet and make sure that the folks they're recommending have available appointments, and they will return that list to you. And then you can call the provider, set an appointment, and feel confident that this is a provider that your insurance company vetted and recommended with availability in network. But that's actually not really what happens, because we're all using the same directory, right? So when a professional registers their license, they have to get an NPI number. In their NPI profile, they're indicating that ADHD is a specialty, and there's really no other deep vetting other than having the ADHD label on your profile. So when your insurance company is calling, and trying to find a resource for you. They may call and say, hey, do you work with adults with ADHD? And the provider might say, yep, and not really have the training or the education or the exposure that someone that might, what have you.
So it sounds like even if you get a list from the insurance companies, you still have to do some vetting on your own. And if you do a search on your own, you could get a provider, but they might not be in network and you might be stuck with a bill that you didn't expect.
Yeah. Second point is absolutely correct. The first point I would say, the way I would say this is sometimes couples are better off vetting and doing the search themselves than relying on their insurance company for a specialty, whether that's ADHD or trauma-based or what have you, because the insurance companies aren't really vetting. Like they're looking at specialties and they're taking the verbal agreement of the provider, but they're not really vetting the match, if that makes any sense. So when couples do their own search, or even if they're taking the list from the provider, they have the right, they can always request like a discovery call or an intro call to spend 20 minutes with this provider before they commit to working with them.
Okay. And one of the things that you said was not asking the right question
Yeah.
or not knowing what to ask. Can you share a few questions or questions that people should be asking when they're looking for a therapist?
Yeah, absolutely. So specifically for ADHD, the first thing I want to know is, what training have you had in ADHD? What exposure have you had to ADHD in adults? Whether that's by practicum or education, do you keep up with continuing education in the ADHD world? What's your approach? I want to know a little bit about if they conform to any type of modality like DBT or IFS, which are different types of treatment. But I'd really want to hear, first and foremost, from the professional, how are you educated? What do you do to stay abreast of sort of updates in this field? And what is your overall approach to couples work? Or if you're looking for individual, what modality do you use?
Got it. That is super helpful. So we've covered a lot about finding a therapist and make sure, you understand what is your responsibility from your plan perspective. One of the things that I'm sure a lot of people have experienced, including myself and my partner have experienced, is that very often we see our therapist leaving the practice. And then we have to restart the process again. What is really going on here? Because it seems like it's a very regular thing that you start working with a therapist, not too long, they start leaving and going somewhere else, and then you have to restart the process again.
Yeah, absolutely. Yeah, so many things are happening in the mental health and insurance world. One could be that your individual therapist joins a group and then later decides they want to work individually and independently. So unfortunately, the way current insurance coverage is set up, if you are tied to a group and you go out on your own, you then have to reestablish credentialing on your own. So there could be a gap, or some individuals go out on their own and decide not to take insurance. We see a lot of more behavioral health professionals no longer taking insurance for many, many reasons. One of them, most simplistically, is that the reimbursement rates are not great for the work we do and the time that we put into sessions. Sometimes there's a very stringent oversight by these insurance companies around our medical records. So they do a lot of auditing, or they'll question why we're using certain codes. And if what we're submitting is not up to par from what they want to see, there's something called a clawback, or they may take back money that they've already paid out on a claim. And what's important here to know is that there is sort of a gray area around, just because a clinician may submit a record that the insurance company says, okay, we're not in agreement of this treatment plan or what have you, doesn't necessarily mean the clinician is not doing great work and making progress. It's just not meeting the standards of the insurance company in terms of documentation and medical record keeping. So there's a lot to be said about that dynamic and that arrangement. A lot of clinicians don't want to deal with the claim submission process. If you think about it, like if you are an independent practitioner and you take, let's say, 12 different insurances, there are companies out there that consolidate this, and you can sort of pay this company and they will credential you with all of the, with half or 4 or 5. But some individual therapists do this independently. So they're credentialed with each different MCO separately. So whatever person they're seeing, they're submitting a claim, then they have to track it and follow up. Did they get paid? A lot of times there can be issues on the insurance side. They're sending checks to the wrong address, or because the MPI or the location changed. So the whole claim submission and reimbursement process can be a headache for a clinician. There can be delays if the submission doesn't contain a piece of information that's needed. And it takes a great deal of administrative time to sort of manage the claim process alone. So those are a couple of different reasons why you may see clinicians leaving insurances or shifting.
Got it. So it sounds like usually people are leaving networks is because maybe their personal preference of if they're working within a group or they want to transition to a personal practice.
Mm-hmm.
It sounds like this is very common in the industry.
Yes.
So let's just follow up with a quick question, is that what if you're working with someone that you actually like and then they transition out? Because I have been in a situation with my partner where they don't tell you until we get a letter in the mail that they are leaving the practice. What do you do then?
As the client, what do I do?
Yeah, what do you recommend the client do when they get the information in the back foot? Now they're like, oh, I need to find a new provider, but I like my old one.
Yeah, I would absolutely call the insurance company to see what they offer in terms of a transitional benefit, saying like, hey, I've been working with this person. And hopefully the provider is being crystal clear around the insurance term. But I understand that there are surprises at times. So if you find yourself in this position, calling your insurance company and saying, is there any transitional benefit available to me that I can work with this provider until I find a new one? Some insurances cover what's called a transitional benefit. So when a provider drops out of the network, some insurances will cover that care for 90 days. And it's meant as like a bridge appointment. So basically what the insurance company is saying is you have 90 days to either adequately and efficiently end treatment or bridge care to another provider that's in our network. So there might be some what we call transition benefits in some of these scenarios where you don't necessarily have to end abruptly when the contract ends. You have some time, but you'd have to call your insurance company to understand more about that. There's also something called a single case agreement. As a client, I would call your insurance company and see, is there anything they can do to honor a transitional benefit? And if not, talk to the provider. As on the provider side, I have seen many clients, even after I've let go of insurance companies, I might offer a sliding scale. I might offer a colleague that I know that is very, very, well-versed in ADHD, and I'll sort of do a warm handoff where my clients sign a release and I can hand them off to my peers so they don't have to feel like they start from scratch. So there's some options, but ideally, hopefully most clients are not in a situation where they're sort of just finding out without hearing it from the provider first.
That was super helpful. Can you share 3 or 4 things about insurance and therapy that many ADHD couples or individual might not realize, but would make a very big difference in getting help?
Yeah, absolutely. So the few things that come to mind is, one, most insurance companies have what's called a case management team, and not many people know about them. This is a team of usually licensed clinicians and peers that are meant to help clients navigate whether it's getting and ascertaining appointments, and even other social determinants of health, like if folks need support with housing or food banks or employment support or what have you. Many insurance companies employ a case management team that you can be assigned a case manager that can help you manage these things or provide resources or pathways to access. These case managers are well versed in what's happening within your state, what might be accessible through state and federal benefits and what have you. So I always tell my folks, like, and this is particularly important for families that may have children recently diagnosed with ADHD, if they need supports in terms of, like, let's say neuropsych testing or helping supports outside of the school system, like socially, utilizing those case managers can be a game changer. And not many people know they even exist. The other thing I would say that many folks don't know, but maybe they do now, that I think folks are becoming a bit more insurance savvy as more people are accessing these services. There's usually always an appeal process for something. So if your case or your care is denied, please call your insurance company and ask what the appeal process is. Some insurance companies even allow the client to request the appeal. And now, in the day of AI and ChatGPT, getting appeal letters and what have you is very easy. Just telling ChatGPT, please write me an appeal letter for this service. So not to be discouraged if something is originally denied, to make sure you move through that appeal process. There's two more that I had in mind. One, the other thing that I think most folks don't know about is a single case agreement. So some insurance companies will allow single case agreements, which is a special and unique agreement between your professional and the insurance company if they are at a network. And you have to meet certain criteria in order to be eligible for a single case agreement. The biggest criteria is that you can't have any sort of similar services available in network within a reasonable radius of your home. So, for example, if I wanted to see somebody who specializes in a trauma-based therapy called EMDR, and my insurance company in their network do not have any working EMDR therapists with availability, my provider can call into the insurance company and say, hey, here's my credentials, here's my training. I'd like to negotiate a single case agreement. So it's a one-off agreement between the insurance company and the provider that would get you, hopefully secure you better rates than an out-of-network super bill would. So it takes time and it takes some knowledge about your area and reasonable distance, by the way. For most insurance companies, it's like 30 miles, but depending on where you live, it may not be 30 miles. So let me give you an example. In the state of New York, 30 miles in like Buffalo, New York, may be no big deal, right? It could be a 25, 30-minute drive. In the middle of the city, 30 miles can be hours of public transit. So again, most insurances do offer what's called a single case agreement if you can prove that the person you're seeing or you want to obtain treatment from is unique in what they offer, and it is not accessible or available in the current network the insurance company provides at the moment. And then the last thing I would say, this is just good to know, is that due to the passing of Timothy's Law, particularly in New York State, there are guidelines around parity, which means basically the behavioral health benefit cannot be more restrictive than the medical benefit, which means, like, for example, if your outpatient doctor, your primary care doctor does not require auth, your outpatient therapist should not require a prior auth. So it's helpful to know, because if you're sensing like, oh, this service is, I'm going through a whole prior auth approval process, it's important to know that that benefit should not be more restricted than the medical. And calling, your insurance company should know when you call and ask them to explain like the process here and what the parallel on the medical side is, to make sure that they're in compliance and parity. They should know that answer.
Thank you for sharing that. I do have a question for each of them, so we'll touch back on. But I think there was one more that we can add to the list that we've talked about, is that about people didn't know that you really don't need a diagnosis for therapy.
Oh, yeah. Yeah, absolutely. You don't need any type of diagnosis for therapy or even reimbursement. A lot of therapists, when they first see you, will usually diagnose you as adjustment disorder as they're starting to assess what might be happening for you. So actually, this is as I'm talking this through, it's important to note. In order to submit a claim to insurance, the therapist needs to have a diagnosis on file. But it doesn't necessarily mean it needs to be your formal or permanent sort of diagnosis, I guess, if you will, for lack of a better word. So a diagnosis needs to be had in order to submit the claim to get reimbursed, but you can see somebody without a diagnosis. You don't need to get assessed or go through any psychological testing in order to access a therapist. Hopefully at some point, as you engage with a therapist, they will help you understand and determine, how they're diagnosing, what they're seeing, what they're assessing, and what have you. You're having that conversation live. But in order to engage in access therapy, no diagnosis is required.
So this is very interesting because a lot of the non-ADHD partners that I talk to, some of them brought up the fact that they want to get their partner to get help, and they're always thinking that they need to get a diagnosis first before they can start seeing a therapy.
Right.
Or at least for their partner. So basically what you're saying is that that's really not needed.
No.
You can actually go straight to a therapist, let them assess, and they'll come up with, whatever the diagnosis is, and then start treating you for that.
Right.
And that doesn't require any type of an ADHD diagnosis or anything else.
Right, exactly. And I would further elaborate that diagnoses can be helpful when you want to understand what a cluster of symptoms may be or to help direct treatment. But at the end of the day, most professionals will work within the symptom set. Like, let's not worry about the labeling. Let's talk about the actual symptoms and how they're manifesting and how to get you in a better state of managing them or being aware of them. There's a lot of diagnostic limitations around ADHD in particular as well, in terms of like different cultural backgrounds and gender and what have you. So it's not at its perfect science. So the diagnostic criteria is not as relevant as many folks think. It's helpful, but it's not an end all be all for treatment.
Got it. So let's go back to the other four things that you mentioned. And I do have some questions. I'm sure other people would like to learn more. So you talk about case manager. You can get a case manager to help you out. How do you get access to one, or how do you request one from your health insurance provider?
When you call your health insurance, usually the first team you're going to talk to, if it isn't like a chatbot or AI, is going to be customer service. And you're going to give them the necessary information like your member ID and what have you. And you're going to ask them, does my plan offer me a case manager? Can I be connected to the clinical case management team? That customer service representative should then connect you to the case management team, which is often a clinician. And then you are able to sort of ask them, and it's good to talk this through, because not every case will be accepted. If you just need support with locating and finding a provider, they might have a customer service representative able and trained to do that. But if you have deeper needs, like finding a more specialized provider or other, like I think I said this before, social determinants of health, like you need to help fill out a housing application, or you need supports vocationally, or you need resources for food banks or mobile food, or you have an elderly family member, so these case managers are able to help navigate some of those confusing resources. So really, to answer the question, it's calling your insurance company and asking about your case management services available to you.
God, it's just that easy.
Yeah.
As long as you're talking to a human, not AI, then you can ask for a case manager.
Yeah.
That's great. That's great information here. The second one is appeal, because I think this one is really worth talking about, because not a lot of people think of the claims are denied, and then you actually have the right to appeal it. So how do you start an appeals process if your claims is denied?
Right. Every insurance company functions differently and require different information. But what I would say is, again, calling your insurance company and ask them to either mail you, email you, or review your appeal rights. And that insurance representative can tell you as a client, or what your professional can do to file an appeal. Sometimes, by the way, there's multiple levels of appeal. So a claim is denied, you appeal it, it's denied again. Sometimes you can push it to second level appeal. So I always say to folks, like, if access to care is very limited and you're struggling to make sure you exhaust all of your appeal levels and appeal rights. And sometimes that can look like you have to send a letter, or your professional needs to call in and do a peer-to-peer, which is two doctors talking about the case. But there are, again, it's hard to give you step by step because every insurance company is different, but most insurance companies do have appeal processes and rights.
Yeah. And I really highly recommend that, not just in ADHD, but in general, when you're dealing with insurance too, because that has happened to me.
Yep.
I had and my situation was, I call the insurance company, ask them for an in-network provider, went and saw the in-network provider, and then we went, did the service and treatment, and then came back, and then they denied my claim when it was a network. And the good thing is, every single call when you call your insurance provider is recorded.
Right.
So there is documentation. So I was able to basically said, I have one of your customer service agent told me this is in network, and now you're denying my claim. And told me that I also, at the same time, they identified the in-network provider and told me that the services was actually it's part of my benefit. So they were able to do the appeals in this situation for me. They file it verbally with me on the phone, and then they went through the process and then got approved. So very important to understand that appeals process.
Yeah, and you bring up, I mean, most insurance companies, and this is probably a surprise to most people, but most insurance companies that I've known, that I've worked for or have encountered, will honor their mistake. So if they make a mistake and they give you misinformation, even though this provider is now out of network, they will figure out how to reimburse you because they've documented that there was an error of misinformation. So to your point, appeals can come in many shapes and sizes. It could be a user error on the other side. It could be the person reviewing the case not having all the clinical information and the provider needing to send more. So there's many reasons why an original denial may be overturned in an appeal process. It's worth it to go through.
Got it. That's great. I didn't know about that. So even when if they made a human error, you can actually still get reimbursed.
Yeah, usually.
So that's great.
Yeah.
At least you try. That's the most important thing. All right. So that's cool with the appeal. That's great information here. And then the single case agreement, I really did not know about that. I know about it from a prescription perspective. Prescription plan have something similar where if this is a prescription that your plan doesn't cover, they at least give you like a short-term supply so that you can go back to your doctor to get a different prescription so that it's covered. It sounds like the single case is kind of the same thing too.
Yeah.
Are there anything that they need to watch for? Because I see this one is very useful for people that are living in the rural area, like you said, where it takes hours to get to another provider because they don't have it in the immediate area.
Yeah, absolutely. I mean, the one thing I advise when somebody is trying to understand if a single case agreement would apply to them is I recommend that client put the legwork on the insurance company, right? So you say, hey, I want to work with therapist A. They're not in your network. However, I'm having some trouble finding people in network. You can actually say to your insurance company, I'd like you to show me, basically like, I need you to show me the list of people that match this person's credentials and their specialty and is within a reasonable radius. It doesn't necessarily mean you need to go out and do all of that research, have the insurance company do that research. And they'll either come back to you with a list of people with availability that is, commutable, or they'll say we couldn't find someone. And sometimes there's back and forth here, by the way, right? Because depending on who is doing the network search, they may not be well versed in the different evidence-based practice. So you might have someone that the person you want to work with is trained in EMDR, and your network specialist on the insurance is giving you 3 options that are absolutely not EMDR. Maybe it says trauma informed, maybe it says they practice CBT, but it's not the same. So sometimes it takes a little bit of negotiation to say, whoa, like the resources you gave me, although have availability, do not match what this person's specialty is. And I want to show you that this is what, so the professional can even get involved and advocate and say, this is why this person needs this specialty type of care.
Yeah. So now that sounds really good where this one can come into usefulness when your existing therapist offer a specific, like you said,
Mm-hmm.
specific therapy. They left the practice and now the immediate area doesn't have it.
Mm-hmm.
Understanding what they offer and you need to go and get someone else that is further out
Yep.
is something that, or out of network is something that you could use this case for. So
Right.
super helpful on that. That I didn't know about. So cool.
Mm-hmm.
I think the last one was you talked about the parity, which we
Mm-hmm.
kind of talked about. Can you just tell us a little bit about the Timothy's Law? I'm not familiar with that. Can you share a little bit more about it?
Yeah, absolutely. And I believe this is within New York State only. So those of you who are outside of New York State, I apologize if this is not relevant information to you. But Timothy was a young boy in New York who struggled with some serious mental health challenges, and the parents had a very hard time getting insurance to cover the treatment he needed around mental health services. So while their insurance and their physical health conditions had broad coverage, the mental health side they really struggled with. Unfortunately, this young man died at age 12. I think he was 12 by suicide. And it really led to the family advocating and pushing for stronger passage of law around mental health parity. Why is it easy for me to call up and get an appointment with my primary, but when my child or when I need a therapist, I have to get a prior auth or what have you? So New York lawmakers really responded by creating the legislation around mental health coverage requirements that dictate the mental health side cannot be, first of all, it reduces discrimination between mental health and physical health coverage. It helps require meaningful access to mental health treatment. And it really dictates the mental health piece. The mental health benefit cannot be more restrictive. I don't know if it's every year or every couple of years, these insurance companies are actually tested through this, right? They have to show proof that their behavioral health benefit is in line with the physical health benefit and it's not more restricting. And there are sometimes changes as a result, right? The auditors will take a look at the submissions and they'll say, hey, your neurological testing here is all free, but the neuropsych testing is not. What say you? And the insurance company then needs to make adjustments around, are we going to make this all free? Is the medical side going to be more stringent? What does that look like? So the insurance companies really have a big responsibility in making sure that there's equal access to coverage.
Got it. That's helpful to know for New York State. So
Mm-hmm.
thank you for sharing. Let's ask a little bit on the HSA and the FSA plans, because a lot of people with medical insurance have HSA and FSA. Can those accounts be used for ADHD-related treatment and supporting expenses that they don't know about?
Yeah, so I'll tell you is that I haven't seen those types of plans reimbursed for things without a billable CPT code. So like coaching or consulting, I really haven't seen a lot of luck in those plans covering that sort of thing. But I do see them cover things like gym membership or certain nutritional benefits, things around self-care that might help someone, well, anybody really, but when we talk about ADHD, we talk about, managing symptoms and healthy diets and exercise and what have you. So I haven't had a lot of success with the coaching stuff being reimbursable, but more concrete sort of tangible items I've seen. And I guess my advice here would be like, you never know until you call and just ask. Don't even follow the lists, just call and ask, because they sometimes give you a list like medical equipment and this and that. Call and see if it'll be accepted and what documentation is needed. It can't hurt.
Got it. That's good. So we talked a lot about people having insurance and using insurance to pay for their therapy. What about people that are either they found someone that they like, they're out of network, or maybe in this situation, there's a lot of people getting laid off and lost their insurance.
Yeah.
And they're in the middle of working with a therapist. What can they do to help themselves if it becomes, a financial burden to pay for therapy? What can they ask of a therapist to do for them?
Yeah, I mean, the first thing that I think most people are probably familiar with is asking for a sliding scale. As a therapist myself, I've worked with clients that I've seen on insurance, then they lose their job and I charge them a nominal fee for a short amount of time until they're reestablished on insurance. So there's no shame in asking for a sliding scale. As therapists, I could tell you, most of myself and my peers, we get it. Things happen. I'd also reach out to your understanding what your local not-for-profits offer in terms of clinics, or sometimes there's educational programs that have folks that are in training that are charging much less for this type of work. I would consult programs and organizations like CHAD and Attitude, because they may have some resources, and depending on your state, I've seen state funded grants that give away sort of services for next to nothing, that they're just funded through grant work and donations. So being aware of what's local to you and what's not for profit could also be helpful.
Got it. That's great to know. Final piece of wisdom here. If you would give an ADHD couples or an ADHD individual a piece of advice about navigating insurance and getting the help they need, what would that be?
Yeah, I would say, and I know this may sound very basic, but I would say absolutely know your stuff in terms of what's covered and what's not. If there's what coinsurance is, what your annual max is, if there's session limits, knowing all of the mechanics of the insurance coverage is incredibly important when picking a provider, because it may help you figure out okay, we'll meet, weekly for the first 3 months, and then we'll start to titrate down because we don't want to go over the session benefit and be in the middle of something. There's a No Surprises Act that was passed a few years ago. So therapists were obligated to give a good faith estimate. If you're at a network, we have to tell you what our cost is up front and what that annualized version would be if you meet with us weekly or biweekly. So knowing it's a fine thing to ask a therapist, how much do you charge outside of insurance? What does that look like? And understanding what your insurance will reimburse. So I hope the answer is not too scattered, but the answer is just know sort of the mechanics of the insurance plan and how that fits in with your provider before agreeing to a session, because I've seen so many sort of surprises and folks not realizing how and get hit with a bill later on.
Great. Well, thank you very much, Ashley.
Thank you.